In today's video, I'm going to quickly go over 3 things that you should know before using Prochlorperazine or Compazine. Number 1, Prochlorperazine is on the Beers criteria. The Beers criteria is a list of medications that prescribers generally try to avoid or limit giving to the elderly population. One reason Prochlorperazine is found on this list is because it can induce or worsen symptoms of delirium. If a patient is at high risk of experiencing delirium, we would try our best to avoid giving this medication. Another reason is because this medication can increase the risk of falls, and in the elderly population, falls can lead to fractures. Generally, the elderly population has poor outcomes when recovering from fractures. Prochlorperazine can also worsen symptoms of lower urinary tract conditions or benign prostatic hyperplasia or BPH, and these conditions are quite common in the elderly population. The decision to use this medication will ultimately come down to the clinical experience of the prescriber, and they will weigh the risks versus benefits for each patient. Number 2, when you use Prochlorperazine, you may be at a risk of experiencing what's called Tardive Dyskinesia. Tardive Dyskinesia is a neurological disorder which causes involuntary, repetitive movements. It is a serious side effect of long-term use of dopamine receptor blocking drugs, such as antipsychotics. And Prochlorperazine falls into this category. Symptoms may include, but are not limited to, grimacing, tongue protrusion, or lip smacking. The word tardive means delayed, and the word dyskinesia means abnormal movement. It is, in some cases, irreversible and oftentimes difficult to treat. This side effect is rare with Prochlorperazine, but it could become more frequent with prolonged use of the medication. And number 3, there are some situations in which patients cannot use Prochlorperazine. This would be known as the medication's contraindications. It cannot be used in children for conditions in which a dosage has not been established. Children under 20 pounds or younger than 2 years of age can also not use Prochlorperazine. As well, patients in a comatose state cannot use this medication. And it cannot be used in the time surrounding a pediatric surgery. Finally, if a patient had recent large doses of alcohol or narcotics, they would not be able to use this medication. That's all we're going to talk about today with Prochlorperazine, but before you take off, I wanted to remind you can pick up a copy of my book, The 5th Episode, Inside the Manic Mind, by clicking on the link in the description of this video. Take care.